Thank you very much. I can't begin to describe how honored I am to receive this award. I remember when Brittany first approached me last year, my immediate thought was Planned Parenthood Advocates of Arizona wants to give me an award for having the fortunate privilege of pursuing my passions in my careers, my personal life, and my way of life. Wow, I am honored. I would like to thank my husband, Phil, and daughter, Alex, who are here, as well as our son, Kevin, who have been ever supportive of my work. And I would like to acknowledge all of you who are here today, because that certainly says a lot. And it does feel good now to have in our government people who are supportive of our goals also. So in the 1970s, when I started college, my freshman major was how to be a hippie. I soon learned that I had missed the peak of the Bay Area flowering children by 5 to 10 years, and my parents were very, very grateful that I had. Redirecting my focus led me to the Vietnam War, Roe v. Wade, and the blooming HIV epidemic, and the failure of the Equal Rights Amendment. Roe had been decided before I started medical school, and because of this, as an OB/GYN resident, I learned only rumors about pre-Roe horrors, and I wouldn't be faced with this reality for years to come. As a practicing OB/GYN, I was humbled daily by the trust patients placed in me when asking me to accompany them through their pregnancy and birthing journey, when women trusted me to help guide them through some very difficult times, such as during complications of miscarriages, tubal pregnancies, premature labor, bleeding, and infections. I knew that I could offer patients the best medical treatment options based solely on their specific situations, their needs and desires, and with their well-being foremost in mind. I never imagined that I could ever be restricted by government and politicians from doing what was best for the patient, even in situations that had nothing to do with abortions. But today, after Dobbs, those best practices are threatened by politicians who lack medical backgrounds and who are intent on spreading falsities to promote their cause. And these politicians, who don't even know my patients, are attempting to intrude on their private, personal lives and the decisions they make. My tenure on PPAZ's board further convinced me of the sobering reality that, in fact, reproductive rights were endangered and were being chipped away continuously with great intention. We could not let them, and we could not take Roe for granted for our daughters and for our granddaughters. After earning my MPH, that's moving further away from hippiedom, my global work as a technical advisor entailed working with country teams in Africa and Asia in building capacity to improve reproductive health care in places with no water or electricity, mired in endemic diseases, war, and humanitarian crisis. Some of my greatest inspirations have come from working with country colleagues with their unwavering commitment to improving the lives of women and their families, despite their lack of so much. And I can't help but compare these countries with ours today, where we have so much, and where we debate the moral issues of abortion without even considering the lives of the women we claim to be protecting. Why haven't we talked with and learned about the women for whom we seem to be bent on making decisions? Dr. Diana Green Foster of UCSF did ask these questions, and in one of the most important turnaway studies, which is this, And if you're not familiar with it, I'd like to introduce you to it. She studied women across the country and compared two groups: those who made it to a clinic within the legal gestational age limitations and were able to have an abortion, as opposed to those who missed that window, sometimes only by just a few days, meaning they were turned away and did not receive their wanted abortion. Now let's consider three common areas of misinformation that today muddy the waters of abortion debates. And then let's consider what the study found to be actually true. First, who are these women wanting abortions? Some would have us believe that they are poverty-stricken, uneducated, uninformed, messed up, irresponsible, unreligious, amoral women, often of color, who don't care about their health or their children. Not true. The study showed women of all ethnic and economic backgrounds seek abortions. Abortions have been a part of normal reproductive lives in women exercising autonomy over their bodies. And women do make thoughtful and well-considered decisions about whether to have an abortion. Next, why do women wait so long, and you can add numbers of weeks depending on where you live, to get an abortion? Certainly, responsible women should be able to decide and get to a clinic by 6 to 8 weeks, or in this state, maybe 15 weeks. It is easy to condemn later abortions in the abstract, but here's the evidence. They are not waiting. For example, how many of you women remember being asked when your LMP was? For those of you who don't know what LMP, that is the last menstrual period, and it's used to determine if you might be pregnant, and if so, how far along you are. And how many of you, like me, often made up the answer? Because we don't always remember or know. I haven't been able to come up with an equivalent male question for perspective. Perhaps like, when did you get your oil changed? Or if you like acronyms, perhaps when did you have your last episode of ED? Furthermore, some women do not have early pregnancy symptoms and don't know they're pregnant. Some women have irregular, infrequent periods like adolescence and don't know that they're pregnant. Some women spot when they should have a period and view it as a normal menses and don't suspect they're pregnant. So these women are not waiting. Instead, they don't know that they're pregnant early on. And lastly, why do women get pregnant in the first place? Now, I know this is a Pandora's box, which I will not open right now. And here today, there are several organizations, including Affirm, Planned Parenthood of Arizona, whose missions are to address this question. So I will answer only with a quote from the study, from a mother who said, her name was Gabrielle Blair, says, unwanted pregnancies can only happen when men orgasm irresponsibly. And so, to summarize the findings of the Turnerway study, there is no evidence that abortions hurt women. In fact, women who had abortions ended up either being the same or better off than those denied abortions. Their mental health was better. Their physical health was better. Their employment and financial situations were better. Their children they already had were better off. There is evidence that some women are hurt by being turned away and instead having to carry the pregnancy to term. This group has more health risks during the pregnancy as well as chronically. They have more mental health risks, including increased anxiety. They are more at risk of economic hardships, poverty, decreased employment, and increased reliance on public welfare benefits. It was harder for them to leave violent partners. And their existing children, that's right, their existing children, had worsened economic well-being and lower achievement of development milestones. It is important that our discussions and opinions be grounded on an accurate understanding of reality for women and their families. I hope you will take some of these facts and share them. Yes, this is where you come in. I am honored to be the chair of the Arizona for Abortion Access Act, a ballot initiative of which Planned Parenthood Advocates of Arizona is an important founder and leader. This initiative will enshrine reproductive rights to abortion for Arizonans. Over the next months, as we collect signatures, and in November 2024, when we vote, Arizonans will have to make a most critical decision about taking a vital step forward for reproductive rights in our state. I believe it is our one chance to ensure freedom from government in making personal reproductive decisions, to have respect, dignity, and empathy for people making their own personal decisions, even though we may not agree, and finally, to trust women to make their own personal reproductive decisions with their providers and families without interference from politicians. Thank you, Planned Parenthood Advocates of Arizona, for honoring me today, and thank you all for being here.